Okay, I'm going to show you how to set up the large volume jet nebulizer, and this can be used on either an intubated patient, which I've got here, or a trach patient, which I've got here, or a patient that's spontaneously breathing with just a regular mask. So what you'll need is your large volume jet nebulizer, and if you can see that arrow, you'll want to pick your FiO2 that you need. So if you needed 40, 60, 80, and then it tells you the corresponding liter flow. So you would set this up, of course, on the flow meter. You need to practice screwing this into the flow meter because that can be a little bit tricky too. So you would set your FiO2 and your flow on the flow meter. You need a water bag, looks like this. You need 2 pieces of blue corrugated tubing. And then however you're going to attach it to the patient. So we'll do just with a mask first. So you'll set your large volume jet nebulizer up with your blue tubing, go into your bag, and from the bag to the patient. And if they were just on a regular mask, you would set it up like this and put it on the patient. So it would look like this. That goes down to your bag, and of course you want the bag kind of dangling down. And then this would go onto the flow meter. If your patient had a tracheostomy as his airway, then it's the same setup. You just change your airway appliance, is what I call it, to trach collar. And then the trach collar has a snap on it, and you just put it over their trach and snap it in place. I got a glare in here, but you can kind of see like that. And I wanted to show you this hole. Some trach collars have this hole and some don't. A lot of people think that this is supposed to be where the trach is for some reason, but it doesn't. It's just an extra exhalation out. So it just fits loosely over the trach. This doesn't stick inside the trach tube. See if I can show you. A lot of people want to do this, and try to get that to fit, and it doesn't. So just a little trick there. If they had an endotracheal tube in place, then that's when we would need our Briggs adapter, and we just go ahead and put our reservoir on. So you've got something that looks like that. So once you get the large volume jet nebulizer part set up, then just how you're going to connect it to the patient just determines if you need, if they have an endotracheal airway, you would use your Briggs adapter. If they have a tracheostomy, you use your trach collar. If they have just a regular spontaneous breathing, no artificial airway, then you just use a regular mask.